I'm Lynn. I'm going to be your nurse today, and I'm going to be doing your full head to toe assessment. Can you tell me what you're here for today?
Just a checkup.
Okay, good. And can you tell me your name and date of birth?
John Smith, 11073.
And his corresponding wristband says the same. I provided privacy. I washed my hands. I've introduced myself. And can you tell me the date today?
August 20th, 2019.
And how did you get here today?
I drove.
Okay. And is there anybody in the lobby waiting for you?
No.
No. So just by doing those initial assessments, I can see that he's alert. He's oriented ×3. He knows where he's at. He got himself here today to the clinic. He also is dressed appropriately for the situation. His affect is bright. I don't have any concerns with any recent or remote memory. I'm going to start by doing your assessment by taking a peek at your hands. Looking at his hands, his nail beds are pink. His capillary refill is less than 1 second. His skin is clean, it's dry. Palmar creases are intact. That looks very good, thank you. I'm going to begin with his head. His hair is clean, it is dry, it is nice salt and pepper color. I'm going to inspect his scalp. I'm going to look for any rashes, any scaling. I don't visualize any. I'm going to palpate the head. I don't feel any lumps, any bumps, or anything that is out of abnormality. I would say his head is normal cephalic. I'm going to move to his face. His skin is clean, it's dry. I don't see any rashes or any indications of any signs or symptoms of inflammation. I'm going to test for cranial nerve number 5, which is facial sensation. Can you feel that?
Yes.
Okay. And I'm going to test for cranial nerve number 7, which is facial movement. Can you raise your eyebrows? Can you puff your cheeks out? And can you smile and frown? Good. Cranial nerve number 7 is intact. I'm going to begin by looking at your eyes. Your eyebrows are full. The sclera is white. The eyelashes are full. Your pupils are black. And your irises are blue. I'm going to pull down on your conjunctiva. Conjunctiva is pink and it's moist. I don't see any discharge, and your lacrimal glands are intact. Very good. I'm going to now test for cranial nerve number 2, which is your Snellen chart, and we're just going to visualize that. And cranial nerve number 2 is also your peripheral vision. So I'm going to ask you to look directly at my finger and tell me when you can see my other finger in your peripheral sight. Say now.
No.
Okay. Look at my finger.
No.
Okay, so cranial nerve number 2 is intact. I'm going to test for cranial nerve number 3, which is accommodation. That's your ability to look near and look far, and I'm going to visualize his pupils. Looking far, they should dilate. Looking near, they should constrict. I can do that in 2 ways, by the test of accommodation. I'm going to have you look at my finger and look at the wall. Look at my finger and look at the wall. I can see his pupils dilating at a distance and constrict when they're close up. I can also do this by the test of convergence. And I'm going to ask the patient to look at my fingers, and I can see at the distance his pupils are dilated, and when I move in closer, his eyes symmetrically converge together and his pupils constrict. Cranial nerve number 3 is intact. Moving to cranial nerve number 4 and 6, which is your extraocular movements. I'm going to test that by doing the 6 cardinal fields of gaze. And I'm going to ask the patient to look at my finger, okay, and follow my finger in 6 positions. I'm looking for any nystagmatism, which is that extraocular movement of bumping. Cranial nerve number 6 is intact. I'm going to get my light source. I'm going to take a peek into his eyes. I'm going to ask the patient to look directly at me. And I'm looking at his pupils, reaction to light. His pupils are equal, round, reactive to light, and accommodation. I'm going to move on to your ears. I'm going to be looking at your ears. I'm going to look at both sides. I'm looking for any abnormalities. First, I'm going to do my general inspection. Looking at the ears, don't see any drainage. I don't see any obstruction. I don't see any signs and symptoms of inflammation. I'm going to palpate the pinna. Does this hurt?
No.
And the tragus, does that hurt?
No.
Okay. I'm gonna get my light source and just take a peek in there a little bit closer. I don't visualize, again, any obstruction. The ear canal is clean, dry, and no signs or symptoms of inflammation. And I don't visualize any ear cerurum. I'm going to test for cranial nerve number 8, which is your sense of hearing, and I'm going to do so with your vision test out of sight, hearing test out of sight. I'm going to ask the patient, I'm going to plug his ear with the tragus and ask him to repeat what I say.
Peanut butter.
Okay.
Baseball.
Cranial nerve number 8 is intact, the vestibular cochlear. Moving down to the nose, I'm going to visualize the nose. It is midline to the face. I don't see any nasal drip. I don't visualize any obstructions at this point. I'm going to inspect the nose. I'm going to have him I'm going to look up into his nares. Nares are patent. Normal cilia is present. I don't see any polyps or any obstruction. Very good. I'm going to test for cranial nerve number 1. That's your sense of smell, your olfactory. I'm going to ask the patient to plug his nose. And what does it smell like?
Cinnamon.
Okay, and then the other side?
Cinnamon.
So, cranial nerve number 1 is intact. Moving down, I'm going to finish the rest of the face. The skin is clean, dry. There are no rashes. I don't see any areas of concern. I'm going to look at his lips. They are full, they are pink, they are moist. His facial hair is equally distributed. I'm going to get my light source out and take a peek into his mouth. Looking inside his mouth, the buccal mucosa is pink, it is moist. There is normal papillae on the tongue. His dentition is intact. Can you say ah? Ah. Cranial nerve number 9 is intact. Can you lift up your tongue for me? Under the tongue, the frenulum is intact as well, and it is well vasculated. I'm going to test for cranial nerve number 10, which is your gag reflex, but we're not going to be gagging anybody in here today. I'm just going to mention it. And then can you swallow? Swallowing is intact. That is also cranial nerve number 9, your hypoglossal. And can you stick your tongue out? Cranial nerve number 12 is intact. I am going to now do some tests against resistance. So I'm going to ask you to push your face against my hand, and the other side. Okay, and then can you shrug your shoulders? Cranial nerve number 11 is intact. That is your accessory muscle. And I'm going to do some range of motions exercises. So can you flex your head down and back and laterally side to side? Very good. I'm going to now test for some lymph nodes. I'm testing the pre-auricular, post-auricular, submandibular, submental, and tonsillar. Is there any pain with palpation? There is no pain. His tonsils are freely movable, and they are non-palpable, which would mean they are within defined limits. Good. I'm going to now check some arteries. I'm going to assess for the carotid, and I do so on either side, one by one, as to not put too much pressure on the carotid artery. Brachial, radial, popliteal, dorsalis pedis, and posterior tibia. All pulses are intact.